Hello and welcome to this Improvement Science Snapshot on the Positive Deviance approach. My name is Ruth Baxter and I'm a This Institute Research Fellow based in the Yorkshire Quality and Safety Research Group. Traditionally, efforts to improve the quality and safety of healthcare have focused on error and harm. Over recent years, however, there's been a growing interest in asset-based improvement approaches, improvement that focuses on what goes right or those who succeed. The Positive Deviance approach does just this. It focuses on the exceptional performers. The Positive Deviance approach seeks to identify and learn from those who demonstrate exceptional performance on an outcome of interest. It assumes that solutions to problems already exist within communities, so members of a community have the tacit knowledge and wisdom needed that allows them to succeed. Solutions are therefore generated from the bottom up rather than being imposed from the top down. The approach also assumes that positive deviants succeed despite facing similar constraints as others. So, for example, it's not just the well-resourced, well-funded teams that look after less complex patients. The positive deviance approach originated in international public health and was used most famously to help reduce childhood malnutrition in Vietnam. The charity, Save the Children, used and identified and then studied families with well-nourished children. They identified various strategies, including better hand hygiene and feeding their children shrimp from the paddy fields, something that's typically not considered to be an appropriate thing to do. By working with the community to spread these practices, they saw a 74% reduction in severe malnutrition among children under 3 years of age. So a couple of frameworks exist to help apply the positive deviance approach. Lots of the international public health applications tend to follow this 4Ds framework. So you define the problem, determine the presence of positive deviance, discover positively deviant behaviours, and design interventions. Some of the frameworks have 2 additional steps of discerning the effectiveness of those interventions and disseminating them to others. Bradley and colleagues have also proposed a 4-stage framework, specifically to apply positive deviance within healthcare organisations. So first, you use routine data to identify positive deviants who are exceptional performers on an outcome of interest. Second, you use qualitative methods to generate hypotheses about how these positive deviants succeed. Third, you test the hypotheses in larger, more representative samples to see if they're associated with better outcomes. And fourth, you disseminate the strategies with the help of key stakeholders. Despite these frameworks, there's limited guidance about how to actually implement the approach. As part of my PhD, I conducted a systematic review which found that positive deviance have been applied to a range of healthcare problems, including increasing adherence to treatment guidelines for acute myocardial infarction and reducing healthcare-associated infections. Most studies identified positively deviant individuals or organisations, and they tended to focus on relatively narrow or specific processes and outcomes of care. At that point, we didn't find any applications that have been conducted in the UK. Since then, our research group have applied the approach to explore exceptional performance in a variety of settings, including care of older people, hip and knee replacement surgery, and transitions of care. In addition, the UK's NHS benchmarking network have applied the approach to improve intermediate care services. Our work has tended to follow the Bradley et al. Framework, and we've used identified positively deviant teams, such as wards, and those that succeed on broader outcomes of care. So through our research, we've identified various considerations it's helpful to make when planning a positive deviant study. So in terms of identifying positive deviants, what routine data are available to you? Are outcome measures appropriate to use, or are they too distal or too blunt? Could you use process measures instead? Are data available at the level that you need them? Lots of publicly available data are only published at an organisation or specialty level, which makes it difficult to identify positively deviant teams or wards. Are you making like-for-like comparisons? So positive deviants are meant to succeed despite facing similar constraints. So are there any coding differences across teams or organisations within the data? Are you able to adjust for confounding factors such as case mix? Moving on to stage 2. What lens are you going to use for your study? So are you looking at specific processes or safety more broadly? And how does this affect the qualitative methods that you're going to use? How many positive deviants are you going to sample? Do you look at a couple in depth or several more broadly? And will you include a comparator to explore how positive deviants differ from others? So sampling negative deviance means that the differences between the two groups are likely to be more stark. However, sampling average comparators might allow you to explore how positive deviants differ from those who perform normally within a population. In terms of stage 3, are data available to test the strategies that you've identified? If not, do you need to create your own measures? And are these valid and reliable? It's also important to remember that just because positively deviant strategies correlate with better outcomes doesn't necessarily mean that they cause them. And depending on the nature of your findings, is statistical testing actually required? Or is there already a wealth of evidence to say that these strategies facilitate safe patient care? For example, with factors such as teamwork and leadership. And finally, moving on to stage 4, which is the stage that we know least about, how you disseminate your findings. Will it be a bottom-up, community-driven approach, or will you get the support of policymakers, such as the Royal Colleges, to help disseminate findings? And one thing that isn't known really at the moment is how closely positively deviant strategies need to be replicated, or can communities take the premise of what's been learnt and apply that to suit their own context? So, in summary, the positive deviance approach seeks to identify exceptional performers, and applications in healthcare are increasing. Bradley et al. Have proposed a 4-stage process for implementing it, and although there's limited guidance to support this, there are, though, various considerations that you can take to support a robust application of the approach. Thank you very much for listening. Please see the further reading for more details about the approach. And if you have any questions or want to discuss using the approach, don't hesitate to get in touch. Thank you.